Well, today our health topic today is brought to you by Orange County Eye Institute, and our topic today is macular degeneration. And Orange County Eye Institute, right across the street from our community, and Dr. Salib, you're joining us today. Thanks for joining us this morning.
Thanks for having me.
Macular degeneration, that affects a lot of people. You know, when you talk about the baby boomers that are now like 80 million, I believe, here in the United States.
Yes.
It affects a lot of people, especially after the year of 50 years old. Tell us, what is macular degeneration?
Macular degeneration is basically a disease of the eye that affects your most central vision.
Mm-hmm.
So it takes away your sharpest, finest, most central vision by affecting the retina, which is the back of the eye, the back layer of the eye, kind of the inner lining of the eye that looks like, that's basically like the film of a camera it takes in the picture. So on the screen, you see a typical picture of what a retina would look like if I'm looking inside your eye, looking at the inner lining of the eye, and you see some blood vessels, you see that white thing, which is that nerve, and then, so on the left, that's what it would look like in a normal situation, and on the right is what you would see if you have dry macular degeneration, where you have an accumulation of substances called drusen, which are basically proteins and fats and other materials, and that causes some weakening of the areas between the layers of the retina, which can cause wet macular degeneration, which is, we have a slide of that also, but basically that's when you have blood in the back of the eye as a result of a growth of new blood vessels. So you could see again what a normal retina would look like compared to one in which you have bleeding in the back.
So for a patient, are the symptoms or the condition they have, does it feel different if it's wet or whether it's dry to them?
Oh, certainly,
Oh,
yes.
it does.
Sometimes with dry macular degeneration, you can't even tell you have it until it gets to a more advanced stage.
Wow.
But as soon as you hit wet macular degeneration, that's when you start to see definite changes. For instance, straight lines will appear wavy. You'll start to have broken areas of lines. People will notice it when they're looking at their blinds. For instance, they start to wave.
Right.
Or letters, when you're looking at letters, and or you know, when you're reading, the words don't seem complete, or they run together.
Right. Now, is this such a gradual condition that, you know, I've seen some examples, and I believe here's a perfect example. So the ones on the bottom, obviously, is people that are affected with macular degeneration.
Right.
Is this such a gradual condition that they don't realize that they're losing the entire center of the vision?
Well, it can be gradual, but it can also be very sudden. So for instance, if you have normal vision, you'd see what you can see on top there. And dry macular degeneration tends to go along slowly until it starts to get more advanced. However, you can go from dry to wet, meaning you could have bleeding in the back of your eye in one day.
Wow.
So it's very important to really keep on top of it by, one, visiting your eye doctor, and two, doing what we call an Amsler grid, which is basically, it looks like a graph paper with lines going horizontally and vertically with a dot in the center, and you just cover one eye and you cover the other eye, and you see if the lines look straight or curvy. And if you start to see curvy lines, then you actually know that you've gone from dry to wet macular degeneration.
Now, when you say they have bleeding in the eye, is that in the back of the eye so they won't physically see it? So like when you have red eyes or something like that,
Right.
this is a condition that only the doctor would probably see.
Right, exactly.
Okay.
You won't be able to see it on a person's eye. Their eye won't be red at all. They can have a completely white eye. It's only when we dilate your eyes and look inside your eye at the retina will we see the blood ourselves. So.
Well, this is an interesting chart because this obviously shows at what age the condition really affects you, and obviously after the age of 80, it affects a lot of people.
Exactly.
But you can see as young as 50, people still suffer from this condition.
Exactly. Yes, we can see some signs of it in your 50s, but it usually doesn't tend to affect people until their 70s and 80s. And by the time you're 80, I've divided it up into intermediate and advanced macular degeneration. So in the red bar is the intermediate, and almost 22.5% of people will have intermediate macular degeneration by the time they're over 80, and about over 10% will have advanced macular degeneration. It's the leading cause of blindness in patients above the age of 50 in this country.
At what point do you call it intermediate? Is it like, say, 20% of the vision is lost, or is there a certain point that crosses it over to the AMD part?
Well, it looks, you basically base it on the size of the drusen and how much degeneration you have. It's not necessarily how much vision you've lost. You can have intermediate without having any visual loss, actually.
Oh, wow. So what are, you know, what kind of hope do we have for people that possibly are suffering from this? What kind of treatments are available to us?
Right. Well, there's a lot of, first you have to be proactive in visiting your eye doctor, doing that Amsler grid, which is that graph paper we see up here, to check your vision, but also living a healthy lifestyle, eating things such as green leafy vegetables, such as spinach and kale, which have substances that are called carotenoids, like lutein and zeaxanthin, which are healthy substances for the eyes. Decreasing your smoking. Smoking doubles your chance of having macular degeneration. Of course, it's also based on hereditary factors, so you can't really change that. But if you have a relative with macular degeneration, you have a 4-fold increase of having macular degeneration.
Wow.
Wearing sunglasses is also very helpful. And if it turns to wet macular degeneration, there's some injections that help to decrease that bleeding in the back of the eye.
Wow. Now, I've seen a commercial that's been going on a lot in the last couple of weeks. I believe it's, I don't want to push any brands or anything, but it's for eye health. Occutive, I believe it's called now.
There's a brand called Ocuvite, there's Preservision, there's a whole bunch of different vitamin supplementations.
Now, are those things, are they effective, and is that a good, you know, preventative, you know, course? Everybody takes multivitamins and eats healthy like we were just talking about.
Right.
Do you find these kind of things also help, you know, in your eye condition?
Yes, in fact, they've been shown to be helpful in patients with intermediate macular degeneration and worse, but a lot of doctors are suggesting them for even patients with mild macular degeneration as a way to just fortify the retinas and trying to prevent them from getting damaged from macular degeneration. But you have to be careful also what the ingredients are. For instance, if you're a smoker, you don't want to take something with beta-carotene because that can actually increase your chances of lung cancer. So look at the ingredients, talk to your doctor, your eye doctor, and your general doctor to find out the best course of therapy for you.
When we were young, Mom would always say, you know, be sure to eat your carrots so you have good vision.
Right.
That's still true to some extent today, right?
Indeed, yes. It can give you a good source of vitamin A as well.
Very good. Well, there you go. Macular degeneration, a very important topic, especially in our community. And, you know, a lot of people throughout the world suffer from macular degeneration. So it's very important that you take care of your eyes, especially if you like to drive. And that is the biggest thing in our community, because if they can't pass that vision test, they've lost a lot of independence. So, you know, you want to make sure that you can take care of those eyes. Go over to the Orange County Eye Institute, located right across the street from us here, just literally right across a couple of the gates from us.
Right, at the Saddleback Memorial Medical Tower on the 3rd floor. We're right there.
Very good. Give them a call at 770-1322 for all your eye needs. And if you are possibly suffering from macular degeneration, be sure and see an eye doctor about that as well. So that is our health topic for this Monday. We'll be back with more of the Channel 6 News Hour right after this.